Welcome everyone. Thank you for coming, and we'd like to very much welcome Fred Fisher, who's a licensed clinical social worker and CEO and president of the ALS Association, the Golden West chapter. And he's here to give us a talk today about the ALS Association, and they've had a program since 2013 to help people with ALS here in Hawaii. And so without further ado, welcome.
Thank you.
Thank you so much for coming. We
Thank you very
appreciate it,
much.
and we'll support you all.
Thank you so much. Well, good afternoon, everyone. I'm very happy to be here to talk to you about the Golden West chapter's efforts in serving Hawaii's ALS community. And the focus of our efforts, really the mission of the ALS Association, is to treat and cure ALS. And what I hope you'll see from my presentation is that developing a therapy is challenging. Developing a therapy without the ALS community being involved is impossible. The first step in finding a cure is outreach and support for people living with the disease. And I hope that by the end of this conversation, you'll have a very clear picture of what the ALS Association is doing for the state of Hawaii in terms of bringing a treatment and cure to its citizens. So first question, what is ALS? ALS is a motor neuron disease, and what you can see on the left-hand side is a healthy motor neuron, and that motor neuron is essentially going all the way from the brain down to the spinal cord. And these motor neurons are very long. So someone my height has very long motor neurons going, but a shorter person, same thing, just not as long. And that connection from the brain to the muscle is facilitated by these neurons. What happens in ALS is a deterioration of the nerve fiber, so that literally the muscle ends up becoming disconnected from any brain signal. And when that happens, the muscles atrophy and die. You may be wondering which muscles are affected. Surprisingly, every single muscle in the body is affected by ALS except the heart. So if your heart can keep beating, but you can't move, you can't speak, you can't swallow, you can't breathe, it becomes very challenging to live. ALS, in terms of what causes the disease, well, the short answer is it's complicated. As you can see from this slide, there are many things that are going on inside the human body that actually create ALS. In some cases, you'll see down here this blow up of this small section of the cell where it's a dysfunction in the mitochondria. In others, it's a pump dysfunction. Cells have a pump that actually eliminate waste that collects in our cells, and when that pump fails, you get the dysfunction of axonal transport systems and accumulation of neurofilaments. In other people, the problem appears to be a glutamate excitotoxicity problem. You also see the involvement of several mutant gene mutations. The first one, SOD1, the latest one listed here, C9orf72, which is the largest known cause of ALS. And down here in the lower right corner, you see problems with the astrocytes. Astrocytes are cells that live within our motor neuron system. Astrocytes actually are thought to have a protective factor for motor neurons, and when those astrocytes fail, the motor neurons become subject to toxicity and die. So we talked about a few genes that are involved in ALS, and what's really impressive about this slide is that going back to 1993 was when we discovered the first known cause of ALS, SOD1. It's a gene that we thought only occurred within families. So people say, well, how do you get ALS? Well, ALS was thought to have two types. familial and sporadic. Familial being that which is caused by the transfer of mutant genes through blood, through birth, not through a contagious effect, but one generation passing it along to the next. And then 90% of ALS was thought to be sporadic. We had no idea why people got it. We had no idea what was causing it. And that's how 90% of the people actually get ALS. And then you see this explosion start back in 2008 through today, where we went from having one gene to now we know of over 30 different gene mutations that cause ALS. So you have a very complicated disease, complicated further by over 30 known causes. The interesting thing about all these known causes is it doesn't necessarily differentiate itself in terms of what ALS looks like. You can have a C9orf gene mutation and lose the ability to speak and swallow first. You can have the SOD1 gene mutation and lose the ability to speak and swallow first. We might not know what gene mutation you have, if any, and lose the ability to speak and swallow first. However, some people lose the ability to walk first. Some people lose the ability to use their hands first. Some people lose the ability to breathe first. Wherever ALS starts, it progresses throughout the body, and that progression, as far as we know now, is not related to any particular gene mutation. So gene mutation, if we know what it is not a predictor of the course of the disease. And the other amazing discovery, besides the fact that we've discovered lots of new genes for ALS, you'll notice that starting back here in 2008, that we started to recognize that some of these gene mutations, which we thought were exclusively familial, actually are also sporadic. That people who have ALS with no family history of anyone else having ALS are testing positive for these gene mutations. And so our understanding of the disease process is growing exponentially, and the talking points that we've had about the disease are changing as discovery accelerates. So who gets ALS? Well, these are some faces you might recognize. Down in the lower left, that's Pete Frates. Pete and his friends are the ones that thought up the Ice Bucket Challenge. The Ice Bucket Challenge really changed the landscape for ALS. It drove an incredible amount of money, which you'll see in a minute, and it's transforming the way we support the ALS community and accelerate research. And up in the top right corner, some of you anybody recognize this person? This is Charlie Wiedemeyer. Charlie Wiedemeyer may be among the most famous Hawaiians that have had ALS, and his wife Lucy is very engaged in helping us raise awareness and funding to advance the search for an effective treatment and cure. So what's the risk of ALS? Well, for adults, it's about 1 in 400, and for people living in Hawaii, that means about 52% of the population are over 40, which means the state of Hawaii, like many other places, the population is aging, and aging is among the biggest risk factors for ALS. What's also not known about ALS is that veterans get ALS twice as often as everyone else. I'll say that again for you. Veterans get ALS twice as often as everyone else, and Hawaii is a state that is home to many, many veterans, about 121,000 at last count. And so the risk for ALS in Hawaii is significant. And a new study that was just released by the United Nations projected that the number of cases of ALS will grow by 69% over the next 25 years. And so what we've been doing here in Hawaii is laying the foundation for the building in a treatment and research infrastructure that can serve people in Hawaii living today with ALS, but also be there for the people tomorrow and the day after that and the day after that who will be diagnosed. So this is a quick slide of what happened with that Ice Bucket Challenge. It was an incredible fundraising phenomenon. It raised $115 million in 8 weeks, which is unprecedented. It's never happened in the history of the world that the internet, that social media, that the whole world became activated that summer around ALS. And people want to know, so what have you done with that money? Well, we've committed about $77 million so far. We're funding services to 15,000 patients per year, and most importantly to the ALS community. We have 150 active research projects in 12 countries. This is the largest neurodegenerative disease research enterprise anywhere. And we're now looking at 2 gene mutations, C9 or 72 and SOD1, that will be part of clinical trials for a new treatment technology called antisense technology, which basically is a gene therapy technology, using a benign virus to deliver a DNA-based drug that will essentially eliminate the gene mutation when it's known. Again, we only know of about 10% or so of the reasons why people get ALS. There was news recently about the first time ever that the FDA is bypassing their investigational new drug application process and going straight into discovery to approve a new drug for ALS. And that's in large part because we created an FDA guidance document to help researchers, to help pharmaceutical companies, and to help patients understand what they can do to accelerate the drug discovery process, and working directly with the FDA to accelerate that approval process. And just in the last 2 years, since the Ice Bucket Challenge, with one of the projects that was funded by that, a full genome screening project, we've discovered actually 3 new genes that cause ALS. NEC1 being the most recent and is now the 5th leading cause of known ALS, all because of that Ice Bucket Challenge money. And one of the opportunities here in Hawaii, directly connection to this genome screening process, is that most of what's known about ALS is understood as a result of studying the North American and European ALS community. And in working with one of our researchers that's funded through the DoD, who happens to be a native son of Hawaii, Dr. Justin Michida, a Iolani grad, by the way. It's important. Need to represent where we can. That we've been engaged, Dr. Ichida, to begin to look at the Asian Pacific Islander phenotype of ALS. And so this is why it's so important to have an infrastructure that can be a gathering place for the ALS community, because then we can invite them into opportunities to advance the search for a cure. So it's time for a pop quiz. Where will the cure for ALS be found? So when you look at all of the activities of the ALS Association, you can see here we have everything we do starts at the top with people and their families living with ALS, our community-based outreach and care service programs, the ALS community becoming activated, telling their story, sharing the need for an effective treatment and cure, sharing the need for care, sharing the need for ALS research funding, and that resulting in both government and private funding for ALS research. And that private funding goes into laboratories that develop ideas around how to treat and cure ALS, and eventually those ideas go into clinical trials at our sponsored clinics. So typically when I ask, so which of these is going to produce the cure? many people say, well, the labs will be where those cures are found. And that's a very common understanding. But when you look at this slide, it shows that that red line is how many new drugs have been approved every year since 1970. And you can see that since about 1987, that red line has been pretty flat. The blue line, though, represents how much money has been invested in research and development into new therapies. And so it's very easy to see that simply investing more money in research doesn't produce more therapies. So there must be something else to this drug discovery process. And so the role of the Golden West chapter is really to execute all of these initiatives, because our belief is that while everything starts with patients and families, every one of these programmatic elements is essential to the search for an effective treatment and cure. You can't drive money into ALS research, you can't drive money into ALS care without the ALS community telling their story. That story leads to public and private money, that money leads to research, that research goes into ALS Association-sponsored clinics where pharmaceutical companies use our clinic partners to run clinical trials. And you can't run a clinical trial unless you have a very engaged and activated patient community. And so far, there isn't an effective treatment and cure for ALS. And so that community keeps telling their story, and every day new people are diagnosed. And if you take any one of these pieces out, if you take the patient community out, or if you take them telling their story out, or if you take the fundraising for research out, if you take the labs out, if you take the clinics that treat the people with ALS but also run the clinical trials out, if you take any one of those pieces out, the whole system falls apart. And so that's why the ALS Association is committed to all the parts, all the programmatic elements that are required to both serve the ALS community and also to treat and cure the ALS community. So a little bit about the Golden West chapter. As you can see from this slide, we are the largest chapter in the country. We serve more people with ALS than any other organization in the country. And this is a graph of the past 3 years where you can see in every month of every year we have served more people with ALS than the prior year. This has been true as long as I've been involved. We are growing as an organization and we are serving more people than ever before, and that was never more true than right now. Our increase in our caseload is approaching 15% this year, and it's not because we think dramatically more people are getting diagnosed with ALS. It's because dramatically more people understand the resource that's available through the ALS Association, and that has been true every year for the past many, many years. In Hawaii, you can see this is a graph that shows the predicted prevalence of ALS and how many of those people, what percentage we're actually serving. And so you can see that we're thinking that at any given time, we're imagining somewhere in the neighborhood of 100 people. We don't really know because ALS is not a reportable disease, and the medical infrastructure up until now has been very weak in terms of focusing on ALS, and so people have often gone undiagnosed. But when you use these prevalence numbers, which is about 7 per 100,000, which is based on an epidemiological study published many years ago, you can see that we're connected to about 80% of the people on Kauai. Now, when we first started in 2014 actually delivering services, we actually had 200% of the predicted incidence of ALS on Kauai. Now, ALS is a disease that typically takes people within 2 to 5 years of diagnosis, and so it's a constantly changing population. So it was 200% a couple of years ago. It's 80% today, and you can see that. We actually have had a patient on Molokai. He unfortunately died this year, but you can see that we are beginning to make meaningful penetration into the ALS community in Hawaii. As I said, veterans get ALS twice as often as everyone else, and as the leading chapter in the country, it would come as no surprise that we are serving more veterans with ALS than any other chapter in the country. And just over the last year, we have actually doubled the number of veterans in Hawaii that we're serving. We're working very closely with the VA to make sure that they are aware of our services and support. What's interesting about veterans and ALS is that while the service infrastructure in Hawaii until very recently for people with ALS has been very weak, the advocacy efforts by the state of Hawaii to support people with ALS and veterans in particular is landmark. Senator Inouye was instrumental in driving ALS research funds into the Department of Defense because of this connection that was discovered between military service and ALS. Senator Inouye was the champion for that effort. Senator Inouye was the champion for getting veterans with ALS 100% service-connected disability. ALS, to my knowledge, is the only disease you get as a result of serving in the military. Other things happen to you, terrible things happen to you as a result of your service, but as far as diseases go, simply serving in the military causes ALS at twice the rate of the general population. Penetration by chapter, again. So we talked about the importance of these certified treatment centers, particularly in not just serving the ALS community, but conducting clinical trials. You can see that we have incubated and support more certified treatment centers, far more than anywhere else in the country. We have even more affiliated clinics. So our priority has been access to care. And I'll talk about that care model in a minute. But you can see that our strategic effort to actually bring care to the local communities where people with ALS are living is far and away ahead of the rest of the country. And when it comes to the population participating in those clinics, you can see that we have far and away not just the highest number of people living with ALS, but the highest number of people actually participating in these multidisciplinary clinic programs. So what does the ALS Association offer? You can see these are the pieces to our puzzle, and they involve ALS clinics and center partners, they involve education programs, they involve augmentative communication programs. When you lose the ability to speak, we loan people speech devices. When you lose the ability to walk, we loan people wheelchairs. Advocacy efforts, support groups, care management, and of course research programs. And I can tell you that prior to 2014, none of this existed in Hawaii. And I'm happy to tell you today that all of this now exists in Hawaii. So life has transformed for people in Hawaii living with ALS. And I can also tell you that all of this is funded privately. We're not we don't receive third-party insurance reimbursement. Everything we do is funded currently through philanthropy. And who cares about ALS? Who cares about people with ALS? Well, typically, it's the person who's been diagnosed, it's their family members, it's their friends, it's their employers, it's their community. And so the same people that are having firsthand experience of this devastating disease are the same people that are funding the program and the infrastructure that will take care of them and that will find a cure. That's a heavy burden for people to bear, but we're very fortunate to have a very engaged and activated community helping bring this program to Hawaii. So we've talked a lot about clinics. What do those clinics do? The amazing thing about ALS is it takes no less than 9 different specialists to treat ALS. When you're losing the ability to breathe, you need the help of a pulmonologist and a respiratory therapist. When you're having trouble speaking and swallowing, you need a speech therapist. When you're having trouble moving, when you're having trouble brushing your teeth, you need an occupational therapist. When your muscles are beginning to atrophy, you need a physical therapist. You need a neurologist. The neurologist is the lead of this medical team. But how on earth can a person who has a disease that requires 9 different specialists, how can that person ever coordinate appointments with 9 different doctors? Well, they really can't. And so our certified center model changes that paradigm. We create a one-stop shop where 5 to 10 people living with ALS, their spouse or caregiver come, they are in an exam room, and every one of these professionals cycles through that room in about a half a day and assesses their need and connects them to the treatment or service they need to manage the progression of the disease. Hawaii didn't have that until this past February when we opened Hawaii's first full dedicated ALS clinic at Kuakini Hospital under the leadership of Dr. Brandon Hirota. So what happens with this lack of service integration? You have clinical services, you have chapter services, and you have research programs. And typically what you see is that these services, these efforts happen in silos. And when that happens, and as you just saw, clinical care is segmented into many different sub-silos and specialty groups, and added is the geography problem, which is well known to people in the state of Hawaii. And each silo tends to have its own area of focus. And when you do this, it doesn't go well for people living with ALS. Now, there's been clinical research that showed if you give people a multidisciplinary clinic experience, that survival is 7.5 months longer. So a disease that takes people typically in 2 to 5 years, now you're adding 7.5 months. Keep in mind that there's only one drug for ALS. It slows the progression by 2 to 4 months. So we're not doing this evidence-based model because it is a good idea, because it's really complicated and expensive to execute. We're doing it because it helps people live much longer than the only FDA-approved drug. Other findings that mortality was decreased nearly 30%, and that if you have bulbar onset, the kind that affects your ability to speak and swallow, 9.6 months of life extension. So now we're looking at 2, 3, 4 times longer life than the only FDA-approved drug will give you. So we're not just doing this because it's the right thing to do. We're doing it because this model of care has been proven to help people live longer and better. They have a better prognosis, and active and aggressive management enhances survival. So this is the crux of what we are doing, and what active and aggressive management means is a multidisciplinary clinic with all those specialists combined with the resources of the chapter. So this was the current state of affairs in Hawaii, where the chapter had all of our resources. We have a full-time care manager that goes to every island, that visits with every family, that assesses their needs, that helps them connect to the resources within their community for support. And you didn't really have all these providers that knew about ALS and knew how to treat ALS. And so what happened is, if people were being diagnosed, they were going on the internet and maybe finding their way to us, or what was the case prior to this past February, is those that knew about us, those that knew about our model of care, and those who were able to would actually fly to California to be treated at our certified centers in Los Angeles and San Francisco. And that's how we became aware of the challenges of the ALS community in Hawaii, because they were coming to us in California. And so what we began to consider and ultimately generated the support here in the state to do was to develop this integrated patient care model where we would take down the barriers between the medical community and our community outreach program. We would create a collaborative intake process, and we would bring the resources of the chapter and the clinic to literally around a single table and create a multidisciplinary team of specialists in ALS for the community in Hawaii, and create this one-stop shop model right here in Hawaii. And so what happens when you do that? That lack of service integration becomes the state of optimal family and patient care, where you are integrating patient care, you're integrating the clinical care, you're integrating the research program into a single program. And as a result, you have all of the clinical services and all of the community-based services being executed in a comprehensive and seamlessly integrated way to provide the best care possible. So for those of you that a half an hour ago or so believed that cures are found in labs, I hope that you can now see that cures are found in people. The people who are participating in a very active, very strong, integrated program that involves elements of a community-based care management program, an outreach program, an advocacy program, a research program, and a clinic program. The search for a treatment and cure really happens when the ALS community is activated. It wasn't that long ago that to find a cure, you basically had to treat a mouse. And there are lots of examples in the research world where drug companies were trying a drug on a mouse, and if it seemed to work on a mouse, that was enough sometimes to get a drug company to invest in taking that therapy into clinical trials. And that the only time a person with ALS had the opportunity really to participate in research was when there was a phase 2 or phase 3 clinical trial to test a drug. And of course you need a clinic to be able to do that. Well, now research has been transformed, largely as a result of new stem cell technology, which results in our being able to create ALS in a dish using human skin cells. That now we don't need to prove ALS works on a mouse. We can actually prove whether a drug has an effect on human ALS diseased motor neurons. But in order to have those humans, in order to have those people available, you have to have them brought together in some way. And so it's our community-based program combined with our clinic-based program where they can donate those blood and tissue samples that can be used by researchers to study ALS in a whole new way. So now, where drug companies and labs didn't really pay much attention to the ALS community because they weren't really necessary until it was time to recruit for a clinical trial, people with ALS are absolutely essential to the research process from very early on at the most basic science research program all the way through clinical trials. And so that's why what we have created is an integrated multidisciplinary system advancing the search for an effective treatment and cure, a system that requires all of these elements to be successful, a system that is currently funded exclusively by the ALS community. And they're a heroic and inspirational group. And so because we found a few years ago that Hawaii's ALS community was severely underserved and only a few could really access the opportunity to participate in research, participate in patient care, we launched an initiative to bring this to Hawaii And I'm very happy to be able to tell you today it's here, and we're doing it. And with that, I'll say mahalo Louis Noah for giving me this opportunity to share our progress so far. Our work is not over. As you can see, we have many more people to serve. We have more research opportunities to take advantage of, but we have all of these elements now in place to build upon. So thank you very much. Any questions?
So, is there any thoughts through why veterans are more likely to get it, and do they get it at an earlier age than other people?
So we have no evidence that they get it at an earlier age. The connection between military service and veterans was actually discovered as part of a study connected to Gulf War I. But when we started doing the research, and there were two studies, one by Harvard, one by Columbia, found actually that this twice the incidence rate among veterans goes back as far as medical records are kept. And it has nothing to do with whether you served in peacetime or in a conflict. It has nothing to do with the branch of service. It has nothing to do with whether you served at home or abroad. It just is. And the clues to ALS, and the research is bearing this out, the talking point that has not changed is that ALS is very likely a genetic predisposition combined with a toxic trigger or stressor. And so it's not hard to imagine the toxic triggers or stressors that might be involved in military service. What we're also understanding that, well, number one, ALS is not contagious, so it can't be, except through the normal process of creating another generation, can't be passed on from one person to another. However, most people get ALS between 40 and 70. 60% of the people we're serving are between 40 and 70, although Pete Frates, who you saw, is in his mid-20s. He's still alive living with ALS. So people get it at all ages, but most people get it between 40 and 70. But now that we're growing ALS in a dish from people who have ALS, their motor neurons get ALS within about 2 weeks. And so why is it that if it's in a dish, it starts in 2 weeks, and if it's in a human, it can take 20 to 40 to 70 years? And the answer is because there's something that we don't yet know going on in our bodies that is helping our bodies fend off the progression of the disease. So it's very likely that ALS is existing in some of us, but something hasn't been triggered so that we begin to exhibit symptoms. But ALS exists probably from the time people are born.
Yeah, this association with the rate of veterans as the general population getting ALS is pretty worrisome, and particularly because the military has not been very transparent in regards to other diseases linked to military service, such as, PTSD, TBI, and Agent Orange syndrome. So I'm wondering, any idea of the extent to which the military is, or the DoD is taking responsibility or being transparent about this link between veterans or between military service and ALS?
Well, this really goes back to the part of this process related to advocacy, where we have the data that proves a direct connection between ALS and military service, combined with the stories of those veteran families. Every year we go to state legislatures, we go to Congress every year and ask for more money through the Department of Defense for ALS research funding. And we've been successful every year. So ALS in the military is really a bipartisan issue. It's an issue that the VA has embraced. It's an issue that the DoD has embraced. because it's clear that there is a direct correlation between military service and ALS. And once we had the data combined with the stories, it was not hard to make the case. And Senator Inouye was a tremendous champion for the country for making that possible. And so we haven't had in ALS the same challenges that you're describing, fortunately. We've been very fortunate. We need more money. The DoD research program is a really good example where our chief scientist is actually on the scientific integration committee. So all the money from DoD, NIH, CDC, all the ALS research money goes to a group of scientists to make sure that the science that's being funded is good, that it's not duplicative or overlapping. And our chief scientist of the ALS Association is chair of that committee. The DoD program, which is focusing on early high-risk research as well as translational research to find an effective treatment, received 160 proposals. So a disease that didn't have a lot of attention now has the attention of the scientific community, and we're getting proposals. About half of those proposals were actually peer-reviewed and approved for funding. But there was only enough money in that DoD budget to fund a handful. And so what we know is we're leaving a lot of good science on the table. And the only thing that's stopping us from pursuing that science is the funding for it. Now, the Ice Bucket Challenge helped with that, but as you can see, that $115 million is more by now than half gone. And so our advocacy efforts continue, our efforts to get those living with ALS, including veterans, to tell their story, to help us raise the money, not just to power the care treatment system, but also to power the search for a cure is essential. Here and then here.
My question was, thank you for this. I didn't know what ALS was. For people who get ALS, maybe on a later stage, is that usually pretty fatal? Or?
It's 100% fatal in most cases. Stephen Hawking, one of the people who is pictured up there, has ALS. He's been living with ALS for 50 years, and he's a really good example of what's possible if you have two things. First thing, you're willing to live in a wheelchair, unable to move, unable to speak, relying on a computer to communicate, relying on 3 healthcare aides to take very good care of you. You're willing to do that, and you're able to do that. That's a very expensive model of care that Stephen Hawking is demonstrating. But what he's demonstrating is that ALS doesn't have to be the thing that kills you. There are 2 key decisions a person with ALS has to make. When they are losing the ability to breathe, are they going to go on a ventilator? When they're losing the ability to chew and swallow, are they going to get a feeding tube for nutrition? If you're on a ventilator, and if you're getting nutrition, and you're getting really good care while you're confined to bed and unable to move, ALS will not be the thing that kills you. Something else will. Now, most people don't have the resources to afford living like that. And so the tragedy is that people have to make choices about what they're going to do. And sometimes those choices are just based on pure economics. Not just what they're going to put their families through, but what they're going to put themselves through, and can they afford the kind of care that will help them live a very long time with ALS. Now, our model of care shows that notwithstanding all of that, we're helping people live longer and better with this disease. The other thing that's important to notice is that once we have a drug that meaningfully slows the progression of ALS, this ALS community is going to mushroom. It's going to explode. It's in a family of neurodegenerative diseases that includes Alzheimer's, Parkinson's, Huntington's, frontotemporal dementia, and ALS. Those 5 taken together, are actually the 5th leading cause of death in the country. None of them have an effective treatment and cure. ALS has a similar incidence rate to Parkinson's, but people with Parkinson's live, in many cases, for a very long time. So the ALS community, people die from it at about the same rate that they're getting diagnosed with it, and so the ALS community never really grows. But we identify and connect with and serve about 40 new people with ALS every month. So if that incidence rate is going to grow, as predicted by the UN, by 69% over the next 25 years, and people are going to start living longer because there's a therapy that effectively slows or stops the progression of the disease, the ALS community is going to be a gigantic community, and there will need to be more resources invested in making sure that there's a system of support in place to take care of them. You had a question?
Yeah. What are the current ALS treatment resources here in Hawaii now?
So we have a full-time care manager, a person, but her professional training is in occupational therapy, but she actually understands all of the different disciplines connected to ALS, speech and swallowing, mobility, respiratory issues. She travels to every island. She lives here in Honolulu, and she is the key link. She's the eyes and ears of the neurologist out in the community. She's a member of that multidisciplinary clinic team. We also have a community outreach person full-time here in Hawaii whose job it is to go out and speak to the community and make sure that doctors, employers, the community at large understand what ALS is and understand the resources that are here. And we just launched, in collaboration with Kuakini Medical Center, Hawaii's first multidisciplinary ALS clinic, where there is now a team of all of these providers working together, holding a monthly multidisciplinary clinic, where all of those specialists literally come into one place at one time and see 5 to 10 people living with ALS. We have support groups on 4 islands for caregivers and those living who have ALS. We have equipment loan pools on 4 islands where we're making loans of durable medical equipment, augmentative communication equipment. We hold educational seminars for people living with ALS and their families, as well as medical providers, so that they understand the impact of ALS. And most importantly, the way that we became the leading ALS organization in the country is by replicating this model in so many places, so that the last thing a physician wants to do is diagnose a person with ALS. Why? Because they know there's no known treatment and cure. And in places where there is no robust service program, the message to those patients has always been, you have ALS, I'm sorry, go home, get your affairs in order, you're going to die very soon. Well, now, when there's actually a program in place, there's a place for those physicians to refer people to. When they see a neurodegenerative disease they can't pin down, and because ALS is a rule-out diagnosis, so you have to, if I started slurring my speech right now, the first thing someone would think is, oh, he's had a stroke. Well, it just might be the first symptom of ALS. Or if I'm developing weakness in a hand. So physicians have to rule out a whole series of diseases. And when they've done that, they're basically end with ALS. And so when we incubate these specialty clinics, we actually create a magnet for the medical community and for the patient community to go and be taken care of. And there's nothing a neurologist or a doctor wants more than to feel like they have someplace to refer a person with ALS to get the help they need. And that process didn't exist in Hawaii before 2014. And it's our Walk to Defeat ALS that started to fund this program. And now we're spending about $250,000 a year in Hawaii. We're only raising maybe a little over 100. And so the ALS community in other parts of California are actually underwriting the cost of serving Hawaii's ALS community, and they're happy to do it because they understand the devastation of being alone with ALS. And so our goal is to not just put this model in place and execute it so that everyone in Hawaii has access to it, but also to find a way to support it and invest more in it. Did I answer your question?
Yes.
In terms of the Ice Bucket Challenge, did the association do anything to help it kind of take off?
No. It's the amazing thing. And it's money that we received from the Ice Bucket Challenge that actually helps underwrite the services that we're providing here in Hawaii, or it has. No, the Ice Bucket Challenge is an example of so many amazing things. It's an example of the power of the internet, the power of social media, the power of activating a community, and that it's not, and the power of the community itself to do something in support of themselves. So I would love to stand up here and say, oh yeah, wasn't that a genius thing the ALS Association did? No, we went along for the ride. We tried to keep up. It transformed everything, and for 3 months, it was all we were doing is to keep up with the community's effort to really change the brand of this disease from Lou Gehrig's disease to ALS, and change the awareness of this disease, and power transformational research. To think that we've got a stem cell trial and 2 gene therapy trials, 3 new genes, 150 research projects, that's transforming the future for people with ALS.
Did the data show any concentration as for the familial kind of ALS? Does it show any concentration in certain ethnic or racial groups?
So we're just studying that now. One of the other public policy initiatives we have is back in 2005, President Bush signed the ALS Registry Act into law. The ALS Registry Act created a registry for ALS within the CDC. And so the CDC has been executing this study, and it's part of our awareness activities, it's part of the research program going on right here in Hawaii, is to get as many people living with ALS in Hawaii as possible to participate in that registry, because there are more than a dozen different data modules to collect information on where you lived, where you worked, what your toxic substance exposure might have been, what your family history is, what your military service is, what your health history is. Do you smoke? Do you not smoke? All of that data, so that we could do what we did in discovering the connection to military service, which is basically a big epidemiological study that showed this increased incidence among veterans. Well, now we're doing a big epidemiological study on every single person living with ALS, and one of the new features of the registry is to be able to include, with people's data about themselves and their life history, include biosamples that are connected to that history. So researchers will now have access to their ALS because they can make it from their blood or skin samples. And so it's a very powerful research program, and creating awareness of that research program here in Hawaii to get people in Hawaii to actually participate is a tremendous opportunity that's available. So we hope that the ALS registry will help shed more light on the distinctions between ethnic populations, the distinctions between geography, to determine what that is. In the past, we used to say, ALS doesn't discriminate based on gender or ethnicity or socioeconomic status. We're now out to prove whether that's true or not.
You mentioned the neuron is degenerated. Is there any test or things can detect the
So you're raising one of the key research areas that we have, and that's in the area of finding a biomarker. And we're getting very close to identifying a biomarker. Because without that biomarker, other than a genetic test to see whether or not you have one of these known genetic forms of ALS, there is no way to know it, and there's no way even to determine it when you start exhibiting symptoms. It can take people a year to be diagnosed with ALS. And so one of the areas, our research is focusing in genes and drug development. It's also focusing in biomarkers to find that clue very early on.